Going on my elective to the South Pacific was a very exciting opportunity for me, as I have not been to that many places in the world, and it was only the second time outside of Europe for me. Travelling to the other side of the world to help those in need and to educate children about oral health and help treat patients in the local hospital of Tonga was an amazing experience. I was looking forward to helping my patients. I never thought I would end up requiring dental treatment myself. The heat and the different air had unfortunately gotten the best of me, and for the first time in my life, I fainted. Luckily, my head and other parts of my body were not injured, however my teeth were not so lucky, hitting the hard concrete flooring. The first thing I thought when I came around was, my teeth, my teeth. It was a very scary and confusing time. One moment I was treating patients, the next I became a patient. I was over 10,000 miles away from home. I managed to get my teeth repositioned after also having my first injection. I had lacerated my lip as well and bruised my cheek and had various other bruises on my body. Not the best way to enter into the first week of your elective. It was a nightmare and I really just wanted to go home. However, the hospital was so caring and helpful and I managed to find the confidence and courage to continue my elective in Tonga.
Hi.
Hi.
My name is Dr. Seeballuck and I'm one of the dentists here. So I can see from my records that you've recently moved to the area.
Yeah.
Now your dentist has been very good and has provided me with the x-rays he took at the time. And I can see from the views he's taken that there's no indications that any root fractures or anything occurred at the time of the trauma. But I'm aware you did have quite significant dental trauma sometime recently.
Yeah, I fell over, I fainted when I was on holiday.
Okay. So when was that?
In July.
Do you know the date of that by any chance?
The 8th, I think.
Okay. And would you know about the time of day
It
that
was
occurred?
like 2:30 in the afternoon.
2:30 in the afternoon.
Yeah.
Okay. That's great. So you were saying at the time you lost consciousness?
Yeah.
Okay. So what exactly happened?
I just fainted basically and then I woke up on
Okay.
a hospital bed.
So you fainted and you woke up in a hospital bed?
Yeah.
Right. And have you ever fainted before?
No.
So you've never fainted before?
No.
Okay. And did you get checked at the time for any signs of a head injury?
Yeah, I think they did, but they didn't do any scans, but they checked that it was okay.
But they cleared you at the time?
Yeah.
I suppose when you went to hospital that
Yeah.
happened anyway.
Well, I was in the hospital anyway.
How long were you in the hospital for?
Just for about an hour.
Just for about an hour. Okay.
Yeah.
That's fine. And so when you fell, did you hit your teeth with anything in particular, or?
But just off the ground, like this sort of ground.
Okay. Do you know what happened to your teeth at the time?
Yeah, so they just basically got pushed in towards my palate.
So did you break any of your teeth at the time, or was it just in movement?
It was just movement, yeah.
Okay, well that's very good.
I think there might be small cracks in it.
You think there might be some small cracks, but
Yeah.
nothing that needed to get repaired at the time anyway. Which is
No
important.
chips or anything like that.
Okay, and were there any other injuries that you had?
No, just I mean a few bumps and bruises, but apart from that, it's fine.
So no other injuries. That's
But
good to hear.
lip, I got like an injured lip from my teeth, but that was all.
Injured lip at the time. Okay.
Yeah, that healed quick.
And the emergency treatment was carried out. Was that in?
The dental hospital in Tonga.
And did you get any treatment done at the time?
Yeah, I got them pushed back to into the arch and then a splint put on.
Okay.
And some x-rays as well.
And how long was it before that got done?
That got done instantly.
Excellent. Okay. And where was the splint removed?
Sydney.
Sydney.
Yeah.
Okay. So that was approximately 3 months ago this all happened.
Yeah.
Have you had any treatment since?
Yeah, got root canal treatment on my central tooth here.
Okay. And how long after the accident did that happen?
Like 6 weeks.
6 weeks afterwards? Okay. And have you had any problems with it since?
No.
Okay. And you previously had a bit of dental work done, obviously.
Yeah.
Was this the first time you've ever had trauma?
Yeah.
Okay.
Flash dental treatment.
So, otherwise there's no other major issues here?
No.
Medically, are you fit and healthy?
Yep.
You're not taking any medications?
Nope.
No allergies to anything like penicillin or latex?
No.
No other allergies?
No.
And you filled out the medical history questionnaire to the best of your knowledge?
Yep.
Excellent. Okay, so what we'll do is we'll have a quick look around, make sure there's no other injuries, and then we'll go from there.
It is important that we keep accurate, comprehensive, and concise notes. All relevant information needs to be recorded in an easy-to-understand format. A simple pro forma like this is an ideal way to document your findings. This can also help compose your clinical information gathering in a tense situation, where it can be easy to overlook a question. Your comprehensive oral health assessment should also be completed in conjunction with this. Always make sure that we have clearly labelled the notes with the patient details, and that we have up-to-date contact telephone numbers and addresses. The date of the examination should be clearly recorded. It is also important that we record the date and time of trauma, and if there was any delay in coming to the dentist. Where and how the injury occurred is also very important. At the initial assessment, we must ensure that the patient has been cleared of any head injuries. And that any tooth fragments have been accounted for. Any non-dental injuries should be noted, as well as if any emergency treatment has been carried out prior to attending. It can be useful to know the extent of dental treatments that the patient has been able to cope with, and also whether the patient has previously had trauma. In the absence of good clinical photography, a simple, quick diagram indicating extraoral injuries can readily record this information. Clearly document any hard or soft tissue injuries encountered in your extraoral examination. An intraoral assessment should be undertaken along with this pro forma. A brief summary of key findings can be useful. It is important to make note of any splints in situ and also record the date it was applied. For avulsions, record the extra alveolar dry time, total extra alveolar time, and any storage medium used. Following this, a diagnosis should be documented. A checklist may also be useful.